Stomatitis is an inflammation of the oral mucosa. What causes stomatitis? Well, and in the context of which diseases does it occur? Where is it found? There are many causes. That's right. And the stomatitis is one of the primary causes of mechanical irritation of the mucous membrane. It develops against the background of bacterial or viral infections, as well as other types of infections, which are already identified by the TORC group. That's right. And so on with other diseases of the internal organs as well. Stomatitis occurs in both children and adults, so the causes of its development can be quite different. But if we talk more specifically about the causes, then it most often develops primarily against the background of gastrointestinal diseases when there are issues with the bile ducts or problems with the liver in general. That is, what is also known as the phenomenon of geographic tongue often occurs, and very frequently stomatitis is associated with it. That's it. Infections caused by viruses and fungi, as well as various bacteria, streptococci, staphylococcus, also lead to stomatitis, as can mechanical trauma from food. And after dental procedures in the oral cavity, we may also observe stomatitis. Parasitic diseases can cause stomatitis. Serious conditions such as HIV, AIDS, and cancer, as well as chemotherapy following cancer treatment, can also lead to stomatitis. Well, smoking and alcoholism also act as irritants to the oral mucosa. Food allergies can cause stomatitis as well. And there are many other factors as well, such as deficiencies in iron, selenium, or B vitamins, where we also observe the occurrence of stomatitis. And even something that might seem insignificant, like the use of oral hygiene products, can play a role. But it's important to pay attention to which hygiene products we choose. For example, toothpaste or mouthwash containing sodium lauryl sulfate can cause symptoms of stomatitis. Taking diuretics and, in general, poor oral hygiene can also contribute. Stomatitis can be classified into two main groups, infectious and non-infectious. So as for multifactorial causes, yes, they definitely exist. Let's take a closer look. Here is viral stomatitis. Viral stomatitis can develop in the context of hepatitis C virus or Epstein-Barr virus infection. With this type of viral stomatitis, blisters filled with clear fluid appear. Then on the mucous membrane, we observe how these blisters burst, releasing serous fluid and forming ulcers. Bacterial stomatitis, it is caused by Streptococcus and Staphylococcus pathogens. As a rule, it is accompanied in the oral cavity by the presence of a purulent infection. The purulent blisters, these pustules, also burst in turn, irritating the mucous membrane and causing erosion. This process leads to ulcers, a clinical picture that progresses to ulcer formation. Fungal stomatitis, it manifests as a white coating due to infection by Candida fungi. And if you observe, when you remove this film, ulcers also form. We also encounter aphthous stomatitis. Aphthous stomatitis develops when immunity is reduced, with lowered immunity, gastrointestinal diseases. And in general, there is also a hereditary factor, right? Like how allergens are passed down and aphthous are observed. Aphthous are 3 to 5 millimeters in size. They are quite painful, very uncomfortable and unpleasant, and they also turn into ulcers. That's it. This type of stomatitis is primarily treated with antihistamines, anti-allergy medications, and sometimes antibiotics are also added. There is also a form of stomatitis called allergic stomatitis. Well, perhaps it is the most common type because allergic stomatitis is observed ahem, basically both throughout the year, and it can also be seasonal. Seasonal, as a rule, occurs when the first berries appear. That's right. That is, people who are prone to allergies can react not only with allergic dermatitis on the skin, but also with allergic stomatitis on the oral mucosa. Exactly. Also, this type of stomatitis is observed in people who wear dentures. There can also be a reaction, yes, a kind of allergy to foods or medications.